Well, welcome back everyone to the 13th Annual Health Current Virtual Summit and Trade Show. For those of you who are just joining us, I am Christy Dye. I am the Chief Business Development Officer at Health Current. This year, we're celebrating a 15-year milestone as Arizona's Health Information Exchange. And just last week, Governor Ducey actually proclaimed this week, October 11 to 17, as Arizona Health Information Week. So we're really excited about that. We'd also like to thank our gold sponsors, Mercy Care and Sonora Quest Laboratories, for their continued support. I'm now going to introduce the next session, Community Coopetition to Address Quarantine Quandaries, which is sponsored by Banner University Health Plan.
Great, thanks, Christy, and thanks for getting that name right. It's a mouthful, and we kind of did that on purpose just to play on words. And we're going to talk a little bit about how community can come together, even competitors, and cooperate to address some really challenging circumstances that we've all been facing and continue to face. As we go into the presentation, I'd like to introduce some of my co-presenters. But first, my name is Jim Stringham. I'm the CEO of Banner University Health Plans. And on behalf of Banner, we're happy to be a sponsor and participate in Health Current's Summit. With me today is Dr. Seth Dubray, who's our Chief Medical Officer for Banner University Health Plans. And he'll be presenting some of the material today. Thanks for joining us, Seth. We also have Dr. Sandy Stein, who's our medical director and psychiatrist for our access programs. And we're pleased to have her as part of the panel today to share some of the best practices and strategies that we worked with the community. And then last but not least, we have Sarah Speakermeyer, who's our Senior Director of Operations for our health plan. So with that, just wanted to maybe set the stage a little bit for today's discussion as we were kind of thinking through the presentation and the challenges that all of us were facing through the COVID crisis. We thought maybe we would share a little bit about some of the strategies and approaches that we took, not just ourselves as one of the 7 access health plans, but also as the community, and focus that around how that community cooperation and coopetition can come together to address some of these challenges that were definitely present and continue to be present with the COVID epidemic, but that can be applied across a variety of circumstances and situations, including some of the impending other types of crises that we might see as a result of COVID, even some of the behavioral health epidemic that could quickly follow based on social isolation and things. And so we wanted to kind of provide that framework and talk a little bit about some of the challenges that we saw with employees, with interacting with providers, and of course, most importantly, with engaging and ensuring our members are getting good care, as well as some of the solutions and strategies that came out of that. And we'll highlight a few of those as we go through. And then we'll kind of wrap it up at the end with showing a quick video of how, strategy what we tried to pull together as a community to help address some of the challenges, like I said, with social isolation. I would encourage you to use the chat feature throughout the presentation. We're going to do more of kind of a panel discussion and kind of bouncing off of one another. And so if you chat your questions or comments, we'd be happy to address those as we go through the presentation. Sarah's keeping score on that for us to make sure we don't miss any. And then we'll also have a little bit of time at the end. So with that, I wanted to talk a little bit about our kind of introduction and approach, for this presentation. First of all, I just want to kind of introduce, Banner and our mission of making healthcare easy so life can be better. And I think that, continues to be a goal and is tested every day. And I think when we think about kind of the COVID epidemic and some of those challenges, how do we really try to live that mission every day so healthcare can be easy when it's really challenging and it's complex and access to care is a problem, and how can we make sure that that continues to be available so folks can get the care they need. One of the things that we want to talk about is sharing some of the best practices as it relates to COVID across these 3 domains on the right of the screen. One of the things is being an Access health plan, we had tremendous leadership from Access and really helping kind of lay the groundwork and strategy and pulling the community together, including the health plans, to help outline how to best approach and what types of flexibilities are needed and how do we pivot in a pretty short amount of time to improve the system and make sure folks got access to critical care. And so we'll share some of those strategies. Also, we've had the opportunity to be part of the Association of Community Affiliated Health Plans. And I was just sharing earlier today, had the opportunity to learn from other CEOs from health plans across the country around how they were dealing and interacting and reacting and responding to some of the challenges. So even in around the late March and April timeframe, when COVID was kind of taking over New York City, and we just heard some presenters from the HIE from New York. I was able to be on calls with CEOs from New York and Massachusetts and talking about what they were doing and strategies within long-term care facilities and identifying safety plans and put some of those into practice well in advance to when we saw some of the spikes in Arizona. And then also the Arizona Association of Health Plans under the leadership of Deb Gollett, really, I think a great example and part of what inspired the title of the presentation of Coopetition, of really kind of all of the different health plans that in some sense are competitors of one another, really coming together to do what's right for the community and leverage resources, pool dollars to do things like PPE, and we'll talk about some of these strategies. But really kind of come together to what is the common good and how do we support providers, support members through this process. And all of that leading to what are those kind of community-based solutions that we can come together and rally around to support our employees, to support our providers, and support our members, because those are kind of the three critical pillars of a healthcare delivery system. And technology has kind of a nice overlay across all of those of how do you leverage technology, whether it be tools like the HIE to share information or other types of technological advancements to make sure that we're connecting and engaging with those different stakeholder groups. And so that's kind of just an introduction and overview of some of the areas that we're going to cover. Before we do that, I just wanted to kind of share a little story about some of our employees and how kind of the onset of COVID and kind of a couple months into it was impacting them, and not just them personally as our employees, but also how they were interacting with their members or the lack of ability to interact with some of their members that they care for, as well as the interface with some of the providers. And it really kind of struck me because we had an employee group come to us. These were our case managers on the Altex program, which is the long-term care program. And, they were saying they wanted to do something in the community because not only were they feeling the impact of kind of lack of connectiveness, they knew that their members who were often in assisted living facilities or other types of institutional settings were really missing that interaction of not just their care managers who they rely on almost as family. Some of these have been care managers for these members for decades, but also, family members and others. And so really kind of rallying together to create an initiative to try to impact social isolation, to try to connect with members and providers in these settings during this COVID epidemic. At the end, we're going to kind of show a little video that talks about kind of some of those steps and actions, but what they ultimately did was, worked within their own families and kind of the broader community to develop letters and cards and messages and notes to get to providers to share with their members to help improve that social connectiveness. And in the video at the end, we'll show some pictures of that, some of the providers and some of the members and some of the team interacting. But the first area wanted to kind of touch upon is kind of the employee strategies. I think all of us faced, some pretty quick challenges that needed to be addressed as folks were looking to, pivot to work from home in the provider community, determining, do you keep the doors open? Do you not? How do you pivot? to telehealth, a very kind of complex home environment, and then how do you keep staff morale strong? For us specifically, I mean, we transitioned 95% of our staff to work from home in just a matter of a week, leveraging technology to help support those staff members in their home environment, but then quickly realizing you could have all the technology and all the support, but there were challenges with childcare as schools were closing, and challenges with bandwidth on computers and competing demand for bandwidth with children. You know, some of the things we did around that was offering flexibility for childcare and other life events. We specifically offered childcare through the Boys and Girls Club through a partnership to offer free care for staff. Really looked, and I know a lot of providers have shared some of these similar examples on modifying schedules to try to work around childcare, allow different types of personal time off and amending our time off and policy around that. And then also providing a lot of education and support through, you know, our leadership bundles, to providing information around some of the campaigns that we're doing, such as PPE awareness or our flu campaign. And then if you see on the right there, really kind of looking at how we redefine engagement and leveraging different types of tools and technology. And on the right is a icon of Pix app, which is actually a member engagement tool that we use at Banner and some other plans use to help engage members and address social determinants of health. Actually turned that tool and leveraged it to help support our own staff and create engagement channels through that tool in order to ensure that staff were feeling connected, that had a voice and a way to communicate if they didn't always feel comfortable communicating directly to their supervisor. And then a key thing is as you pivot and adjust to that work from home, how do you have the right metrics and oversight to ensure you know, staff are still being productive and impacting member lives? And we actually saw about a 20% increase in productivity of staff in that work from home environment, where prior to COVID, we had about 30% of our staff working from home. Kind of post-COVID will probably be the opposite and have about 60 to 70% of those staff working from home. But I'm going to turn it over to Sarah, and Sarah's going to talk a little bit about some of the solutions and examples of some of the engagement and interaction that we were leveraging with our employees before we talk about providers.
Thank you, Jim. Yes, I want to touch on enhanced virtual interactions. That was one of the key strategies for us to continue engagement with our staff, again, is monitoring productivity like Jen mentioned, and then it was a big focus on staff morale because this was a challenging time for all of us at home. Some of the different types of virtual engagements that we did individual team huddles, we had roundtables and town halls for all staff. We also ended up expanding our Lunch and Learn program, where those have been mostly focused around compliance training or operational updates, and we expanded those to be able to teach staff about the different virtual technologies that are available to them, and then also focus for them at home. We had power lunches around power of positivity and mindfulness for prevention. But one of our successful strategies that I was going to take a little bit of a deeper dive into was around our social media campaign. So Jim, we'll go to the next slide. Thank you. So this is an example of one of our first campaigns that we started during COVID, our Mask Up campaign. And the goal for this was we really launched this to engage our members and community. But one of the amazing outcomes of this was the engagement and the interaction that we saw with our staff. It was another way for them to be able to connect with each other. Leaders throughout the health plan got active in these different campaigns, and we saw as you had posts from leaders posting pictures, comments, or videos, the engagement of that campaign increased even more. I will go to the next slide. So we continued with different social media campaigns during COVID. This is another example that we have up there on the I Stay Home for campaign. And because of this success, we ended up launching some additional campaigns. We have several that have been led by our Office of Individual Family Affairs around a gratitude challenge, Reflect and Connect, and one of our current campaigns around self-compassion. We continue to see increased engagement with each of these. And what's been on next on the horizon for us for social media was being able to expand to other populations and demographics. As we know, certain demographics are more likely to go to Facebook while others to Twitter and Instagram. So in July, we expanded to Twitter and saw about the same amount of engagement, if not more, on certain campaigns, and are in the process of kicking off an Instagram account. And as I mentioned before, because of its success, we are also moving to utilizing this for the flu, because that is our next focus with COVID, is to focus and make sure everyone's getting their flu shot. So with that, I will pass it over to Dr. Seth DeBry to cover provider strategies.
Good afternoon, everyone. I hope you all are doing well. We took a similar approach to our provider strategies. That's not a one-size-fits-all when you're working with providers. Our challenges were communication. We weren't able to go out and meet with providers face-to-face, which is something that we really enjoy doing. We knew that there were going to be access to care issues as people were pivoting from office visits to telehealth, and there's a lot more about telehealth coming up. We knew PPE was a big issue, and then provider sustainability. People were worried simply about paying their staff, paying themselves, and keeping the doors open. So some of the things we did is we really leveraged our existing communication channels, CEO to CEO. Jim and Dr. Stein met frequently with provider groups. We held some CMO meetings after work to brief people on COVID and what was happening within our organization. We soon found that there were a lot of meetings and there was a lot of information going out. So within the greater Banner Health Network, we consolidated those meetings so that providers wouldn't have to go to multiple meetings and would get a consistent message. We increased communication with our providers through fax, email, fax blasts, website FAQs. Our website team did an amazing job with turning things over fast and furious, and working closely with Health Current and the Arizona Health Plan Association on providing consistent messaging across the board. We also provided outreach calls and provided town halls to our providers. We worked with the Arizona Health Plan Association and all the other health plans in Arizona to provide PPE for our providers, which was very welcome, providing face masks in a time when a lot of people could not get face masks. They could use them for their staff, they could use them for patients, and it really helped engage them. I had the pleasure of delivering a lot of it face-to-face, and it was a great experience. A lot of our staff, I sent out an all points bulletin saying I need help delivering this, and we actually had too many volunteers. We couldn't use all of the volunteers that we had, which was heartwarming. And it was nice to see how engaged people were. We also worked on pivoting to telehealth, and I'm going to turn it over to Jim to talk a little bit more about some of the partnerships and telehealth opportunities.
Yeah, no, thanks, Dr. DeBry. Around the partnerships, I think a couple of things are important, and I think as it relates to provider and kind of that provider sustainability of that streamlining of information, there's a lot of information coming out around the PPE dollars, the different enhanced funding coming out for the federal government. There, just a little plug, phase 3 funding is applications are due by November 6th. So if there are providers on here and there's opportunity for additional funding from the federal government. And so how do you communicate that out so providers weren't getting 7 different messages, 7 different links? And one of the things we did is we partnered collectively through the Health Plan Association with Health Current to create kind of a centralized communication vehicle for providers to put information out like that. So that's just one example. But the telehealth is probably the, kind of the biggest, I want to say, kind of savior around access to care and the ability for providers to not only provide services for members, but for many providers to be able to draw down dollars to pay for employees and different things like that. So I wanted to share a little bit about kind of what we've seen and continue to see on the telehealth front, and I'll provide some graphs and some detailed slides on this. This slide, represents a couple of different things. I'll kind of start on the left with the bullets. I mean, we saw this is just through the end of June because there's some claims lag, but almost over 200,000 telehealth claims paid to date in 2020. And you can kind of see the trend lines across the right as the economy opened back up, kind of that June, July, telehealth claims flattened a bit, but overall increase in volume by over 348%. The two different lines on here are interesting. The blue line represents providers that were already doing some sort of telehealth billing prior to COVID. And I think ironically and serendipitously, a lot of this was in the behavioral health space, as behavioral health providers kind of already had some of the tools and technology set up for telehealth, and but still saw that same kind of increase in overall volume, kind of then leveling out in June and then slightly dipping. The bottom represents those providers that had never billed or provided any type of telehealth service, and then you see in March, slight uptick, a lot of education, training, offering resources and tools for telephonic visits. It starts to go up over 8,000, 15,000, then almost 17,000 before it starts to flatten out. So just kind of interesting how those two trend lines kind of mirrored each other, but there was a cohort of provider groups that definitely kind of had an advanced head start on this, but really was essential to make sure providers had good access to care. Just a little bit more information. I mean, not surprisingly, this is just from our data. Others that we've talked to have similar, but on across all of our lines of business, the Access Complete Care, was the largest as far as visits per 1,000 members. You kind of see that same kind of trend line from a claims per 1,000 based off of our three product lines under Banner University Health Plan, the Altex ACC, and then the UCA, which is University Care Advantage, which is the DSNP program, but very, very similar trend lines on the telehealth on the left. And then you see kind of the office visits on the right kind of going down kind of as things started to open up kind of in April and May, starting to slowly kind of come back up on the UCA side, but still kind of just level or continuing the downward trend on those other lines of business. Kind of telehealth versus office visit by age group, just more illustrative than anything else, but we really see kind of that equal utilization for males and females on telehealth, but females have show a slightly higher rate of overall office visits, just kind of how these trend lines come across for our cohorts of members, but found that very interesting. And then if you look by provider type, as I mentioned before, on the telehealth on the left, you see behavioral health outpatient, that blue line, which kind of was already slightly above some of the other groups like physicians, registered nurses, even the FQHCs, and then kind of the big spike, and then a little bit more dramatic kind of fall off where the others all kind of follow a fairly similar trend line, and then the corresponding office visits kind of going down, representing kind of the offset that's happening on the telehealth side. But again, just thought it was interesting information. Wanted to share this just from telehealth, and this came from evisit.com, which did some patient experience surveys around telehealth. Telehealth, as I think most folks know, is here to stay. I mean, our members are going to demand it in some sense, but 75% of Americans have experienced interest in telemedicine. 95% report being satisfied. 21% of respondents use telemedicine due to lack of travel time. I'm not going to read through each one of these items for sake of time, but there's a link in here as well for more information on that. But there's definite kind of desire, need to continue telehealth, and I've experienced it even in my own household with kids and spouse, and just really some of the convenience around it. But with that said, how do we ensure that telehealth has the right kind of guardrails, that there's not inappropriate usage or abuses, that there's the ability to do in-person assessments when needed and necessary, And so there's actually a telehealth work group being, led by Dr. Salek at Access, and a number of folks involved with that, kind of thinking through, again, telehealth's here to stay, but in what context, and how do we make sure that we're maximizing all the benefits that I just talked about without any unintended consequences. So, some of the things that we've been thinking of and guardrails around monitoring just the utilization month over month, just to see how those patterns happen and occur. I shared some of that already. The quality data, looking at clinical outcomes and the ability around medication adherence and readmission to see if there's any changes with that. Data mining, just to make sure services and non-telehealth services reported by the same provider for the same data services aren't happening. And then just reviewing of kind of outliers, code trends, flag providers, any types of spikes and reports, just making sure there's the proper monitoring like anyone would do with any other services. But really excited to see the use of telehealth and kind of where this goes as it relates to access to care, particularly in some real challenging areas like childhood psychiatry and other things. So excited to share that. So with that, we're going to turn it over to the last section, which is some of the member strategies, and Sarah and Dr. Stein.
Thank you, Jim. So for member strategies early on in COVID, one of the biggest challenges we saw was around transportation and access to care. And in the spirit of in the title of our presentation, the Coopetition, this was another example where the Arizona Health Plan Association, all the access plans, and our transportation vendors, they all came together to develop a non-emergency medical transportation work group and focused on developing a fleet to be able to transport members that needed to get COVID testing, or members that were positive with COVID who needed to get to their medical appointments. And then toward the other challenges around social isolation and loneliness, we continued member outreach strategies, similar that you heard me speak about around employees. We continued social media for our members as well, focusing those more around utilizing educational posts and public awareness of materials from the CDC and linking members to resources. And then good old-fashioned postcards. While we were able to engage with a good portion of our members through technology, whether through our website or through social media, there is a good portion that do really like getting a card in the mail. So we sent postcards, and as Jen mentioned at the beginning of the presentation, we had several staff develop individual letters and cards that went directly to members in the higher levels of care. And with that, I'll pass it over to Dr. Sandy Stein.
Great, thank you, Sarah. I'm going to talk a little bit about our collaborative care model approach and utilizing technology. Next slide, Jim. So when we think about a collaborative care model, we're really looking at that from the broadest definition and leveraging multiple strategies in the focus of member engagement. One, health plan, provider, and community collaboration as essential components. Two, best practice models that I'm going to speak to in a few minutes. And three, leveraging technology. And when you look at the first box here, maximizing support for COVID-19 positive members and those at greatest risk, we really focus. And for all COVID-19 members that are positive, we've utilized a new care. I'm sorry, my earphones are falling out and you probably can't hear me. Sorry about that. Challenges with technology. New care enrollments for all positive members, and certainly focusing on education and support for all our members that are high cost and high need. We know that that's absolutely critical, and certainly encouraging the use of telehealth, and you've heard a lot about that as Jim has spoken about. And some of our members had challenges in utilizing telehealth. We utilize three-way calls to really support them with very positive outcomes. And we've also been very focused on our members with chronic conditions, both behavioral health as well as physical health conditions. We've been focused on members with depression and launched a depression care management program, have been focused on our members with CHF and diabetes, and have been very focused on ensuring that they have medications and medication adherence, and maximizing connection with needs identified with social determinants of health, and focused on those that are readmitting. And one of the keys is that we developed a database for social determinants resources that we've been utilizing broadly. The next box here are virtual collaborative care approaches. That really focuses on evidence-based approaches like the AIMS model. And for the AIMS model, I think many of you are familiar with that, but it focuses on utilizing a team-based approach that is led by a primary care provider. And that primary care provider is working with a behavioral health care or case manager and a psychiatric provider looking at outcome-based approaches driven by metrics. And we're working on expanding that and adding a little bit of innovation to that. So as we look at our telehealth approaches, connecting our behavioral health and physical health providers with our health plan care management teams and provider case management teams to have a really innovative and broad approach to virtual care. The next box we're talking about focusing on an integrated care management approach and really maximizing behavioral health and physical health and those diagnoses and the treatments because we know they have to go hand in hand, and certainly maximizing social determinants of health because we know in many respects social determinants of health has a much more significant impact on the outcomes and costs associated with healthcare than even the clinical services do. OIFA, or our Office of Individual and Family Affairs engagement, we've had very proactive solutions and outreach and supports, and we've engaged very proactively with our peer and family-run organizations so we can get those peer and families in sessions with members, particularly during telehealth, to make it more natural, particularly if they are limited and in the home, so they're not so lonely even during COVID, and that's been very successful. The next box here, Banner Health Plan, Provider, and Community Partnerships. You can hear this theme throughout the presentation that we're focusing on partnerships, and we feel very fortunate under the Banner umbrella that we have Health Plan Insurance Division as well as a provider line of business. And we've worked really proactively together. I wanted to give an example. We have what's called the Banner Urgent Care Program. And what we've done is worked with our community behavioral health and integrated providers with our focus on our members with comorbid behavioral health and physical health conditions. We know that often they overutilize EDs and higher levels of care. And in working together, we've been able to divert members from those higher levels of care and crisis kinds of treatments to the urgent cares where they can get their services met in a very timely way. And that's 47 urgent cares across the state that have specialized training now and working with members with behavioral health disorders, and they all have telemedicine services right now. And moving along to the PICS slide, Jim mentioned this briefly at the beginning. PICS is an app on a phone, and it's focused on social isolation and loneliness and minimizing that, members at risk for anxiety, depression, and social determinants of health as well. And we started using this way before COVID, but it's a perfect solution right now to really support our members to ensure that social distancing that we're all facing doesn't turn into social isolation and loneliness. And we're able to provide resources and supports, what's critical, real time for our members. We're seeing great member satisfaction with this. We're seeing great outcomes. We're seeing decreases in ED utilization, decrease in inpatient utilization, and overall decrease in costs. And we're working on continued expansion. And the last thing that I wanted to talk about briefly, strategizing to address COVID-19, the associated behavioral health epidemic. You can't turn on the TV, open up a journal, look at your social media without hearing something about the behavioral health epidemic associated with COVID-19. We know that there's numerous behavioral health symptoms and diagnoses that are presenting across the United States and really the world that can be associated with significant morbidity and mortality. There's been lots of data. The CDC has done a tremendous amount of research, and just high level, they're reporting the most vulnerable groups are those that are younger adults, are racial and ethnic minorities, essential workers, and just high level, some of the striking stats that we're talking about is they've reported a tripling of anxiety since COVID, a quadrupling of depression, and certainly with youth, we're seeing very striking data. About 70% of youth are saying they're very concerned about mental health, and of those, 80% are reluctant to ask for assistance. So that's a real critical issue. We're taking these critical implications as a public health emergency, and we're taking on a community response, just like you've heard about before, to address this in an integrated and collaborative way. We talked about this at Jim's CEO meeting a couple of weeks ago, and I'll be addressing it at my provider's CMO meeting. In addition, we have a large community meeting that's coming up on Friday. We're really excited about that. That's called COVID-19 and the Behavioral Health Epidemic Collaborative Strategies. And that's really going to be our kickoff, how we address this from a community perspective. So that's what I have. And next slide.
Yeah, thanks, Sandy. I think that's an important one, and one that we might circle back after the video with a couple of questions. And I would remind folks to please chat in any questions that you might have. But I think kind of related to what we just discussed, we're going to just show a quick video, which is kind of a highlight of some of the discussions and strategies that I mentioned early on, where some of the care management teams understanding the impact of social isolation and what impact that was having on their members, but also personally the impact it was having on them, kind of put together this letter campaign and partnered with some providers to try to get information and materials and cards and notes of encouragement to the members. And you can see some of the pictures and responses of that and what an impact that had. And that's just a nice note from our Altex leader, Larry O'Connor. The passion of our care managers have for their members shines through. And I just think that's a great video. And it's not just our staff, it included pictures of some providers and members and other things. And for the really trained eye of folks who are paying attention, Hugh Jackman is not on our actual team. He was just doing a cameo in that second slide that popped up. I'm trying to move beyond it. There we go. So with that, we're going to kind of open it up for any questions. And while we're waiting for any questions that might come through, I do want to kind of put one question out to either Dr. DeBry or Dr. Stein. We've been reading kind of a lot around COVID. We talked a little bit about the behavioral health epidemic, but also kind of the impact of substance use as it relates to COVID and social isolation. So I wasn't sure if anyone wanted to comment on that specifically.
Sure, I certainly can take that. We're certainly seeing a significant increase in risks and substance use. We're seeing, starting to see in national data, certainly an increase in overdoses. I know in Arizona, we're starting to see somewhat of an uptick as well, but we don't have any really long-term data already. We're certainly addressing that in a very proactive way at Banner University Health Plans for our members that we know are struggling with substance use or having significant risks. Our care management teams are reaching out very proactively, and they're collaborating very closely with our physical health care management teams to ensure an integrated approach to care management, because we certainly know those that are having issues associated with pain, certainly significant stressors, new catastrophic diagnoses are at even higher risks, and then certainly those struggling with social determinants.
Dr. Stein, I think excellent points. I would like to add too that we all need to be cognizant of our own stressors. It's with personally, friends, family, whether or not someone has a diagnosis of substance use or abuse. A lot of people are trying to figure out how to cope. And we've done a lot of work with our providers, as Dr. Stein and Jim have mentioned. But we also try and give tips to our employees. We have weekly tips that go out on how to cope, how to manage at home, you know, being mindful, exercise, things that you can do to deal with the stressors associated with COVID that don't involve alcohol or other substances. Because we all thought this may be a sprint. Unfortunately, it's a marathon. And people are having to find healthy ways to cope. And it's not always easy, especially if you have kids working from home. Maybe people have lost their jobs or their hours have been cut. There's a lot going on, and just being cognizant of that for everyone we work with and ourselves is really important.
Great.
I'm sorry.
Go ahead, Sandy.
Oh, I think the other piece is we're seeing an uptick in potential substance use for those individuals in transition. So those that are transitioning, they've lost jobs, they have, as Seth was talking about, additional issues with social determinants. And we're seeing for youth, particularly those youth that have had challenges with milestones that have been disrupted. So those that have been perhaps graduating from college or graduating from high school, but didn't get to go through those rites of passage. Those that didn't get to go through orientations for college and new jobs, and have had really struggles with that as well. So I think that's a critical piece.
Yeah, those are both great points. Looks like we're about at our time, so I just wanted to close by thanking everyone for your participation. Our contact information is on here in case you have any questions, or if you want to be involved in any of the activities like the Behavioral Health Epidemic Strategy Group. And I hope that this was helpful. I think the idea was around kind of the community coming together to address COVID and some of those strategies, but I think the bigger point is what of that can apply to other types of situations, because there's a lot going on. And so how do we come together? How do we work cooperatively as a community to address these public health issues, these public health crises? And when we do, it impacts those and has an impact on those that's most important, which is the members that we have the opportunity to serve. So thank you very much.